only mode.
Hello everyone and welcome to the webcast. My name is Christine Dursey and I'm the Executive Director of APA Ohio and the Vice Chair of the New Urbanism Division. I will be moderating today's webcast. Today, Friday, September 6th, we will hear the presentation, Does Gender Matter in Planning for Aging? For technical help during today's webcast, type your questions in the chat box found in the webinar toolbar to the right of your screen or call the 1-800 number shown. For content questions related to the presentation, type those in the questions box also located in the webinar toolbar to the right of your screen. We will answer those at the end of the presentation during the question and answer session. On your screen is a list of the sponsoring chapters and divisions. I'd like to thank all those participating sponsors for making these webcasts possible. Today's webcast is sponsored by the Virginia chapter. For more information on this chapter and how to become a member, visit apavirginia.org. And to learn more about all the chapters, visit planning.org/chapters. On your screen is a list of upcoming webcasts. To register for these, visit utah-apa.org/webcasts. And of course, as always, to log your CM credits, just visit planning.org/CM, select today's date, and select Does Gender Matter in Planning for Aging. And of course, like us on Facebook, Planning Webcast Series, to receive all the up-to-date information that we have. You can always view our videos. We are recording on youtube.com/planningwebcasts. And don't forget, all of our previous videos are also located there. If you would like a PDF of today's presentation, email me at planningwebcast@yahoo.com. And this webcast is available for 1.5 CM credits. I'm now going to turn it over to Elizabeth Friel. She is the Professional Development Officer for the Virginia chapter, and she's going to introduce our speakers.
Thank you, Christine. This is Elizabeth Friel. I'm the Professional Development Officer for APA Virginia. And I'm very pleased to have with us today Dr. Mildred Warner. She's a professor of city and regional planning at Cornell University, and her work focuses on local government service delivery, economic development, and planning across generations. Her work in planning across generations in particular explores new community development models for addressing human services and linking the needs of children and elders to those models. Dr. Warner is the author of over 100 publications, including top articles in top journals such as the Journal of American Planning Association. She won an award for Best Article in 2011 from the Academy of Management, Public, and Nonprofit Division. She's a research-affiliated scholar with the Institute for Women's Policy Research and a research associated with the Economic Policy Institute in Washington, D.C. Also pleased to have with us this afternoon Jana Lynott, AICP. She's a Senior Strategic Policy Advisor on the Livable Communities team at AARP's Public Policy Institute. Jana manages AARP's Transportation Research Agenda and is responsible for developing the content of the Livable Communities chapter of the AARP Policy Book. Her recent publications include Planning Complete Streets for an Aging America, Aging in Place, a state survey of livability policies and practices, and Weaving It Together, a tapestry of transportation funding for older adults. Jana, prior to being with the AARP, was the Director of Transportation Planning for the Northern Virginia Transportation Commission, where she designed a groundbreaking study on the linkage between land use and mobility of older adults. We're so pleased to have our group with us, and so pleased to have you all in attendance. With that, I'm going to turn it over to Dr. Warner. Thank you.
Hi, thank you very much. Let me bring this up. Great. Thank you very much. Today I'd like to talk with you about an overview of a framework for thinking about how we can do better planning for aging and particularly pay attention to the needs of women in that process. I want to acknowledge support for the research that I've been doing has come from the U.S. Department of Agriculture National Food and Agricultural Initiative to give a particular emphasis to the needs faced by small towns and rural communities. Of course, when we ask the question, does gender matter, the answer is an emphatic yes. First, women live longer, a lot longer than men. It's shortening, but it's still longer. They have lower income and lower wealth. And so this creates special challenges for planners to think about. Share of the care burden, not only for children, but also for elders, their parents, and for their partners as they age. So women actually never get to retire. They're always caring for someone. And those care burdens, planners could do something about that by providing better designed communities and services that help to reduce the care burden on women. And finally, it's really important to note that poor and minority women are especially vulnerable. Their care burdens are great, and the income challenges are also great. So what I'm arguing for here is that a gender lens requires a multi-generational planning approach. So you think about the woman in the middle, the sandwich, and the little kid on one side and grandma on the other side. And when you think about that, you might think about the possibility of meeting the needs of children and seniors through a common framework that pays attention to inclusive design that looks at the needs of children, say pre-car, and frail seniors, say post-car generations, and how that might affect the way we redesign cities. My hope is that as we begin to redesign cities for our increasing aging population, we will also recognize that young children could benefit from designs that are sensitive to their needs as well. So sort of broaden the aperture on your camera so that you can look at both ends of the life cycle. If you do that, you'll improve the independence of both ends, and you'll also reduce the stress on all the rest of us who are the sandwich folks in the middle. We can also think about this in terms of service design and the potential for shared services. So much of our work silos services into services for children, services for adults, services for older adults, and I think there's a lot more possibility for sharing services than we've given attention to in the past. And I think if we do this, we then have the potential for building a common vision so that as a community we can come together to make the investment choices that we need to make because it could benefit us all. My frustration has been that the work to date has been segregated by age. You have UNICEF leading an international initiative for child-friendly cities, and you have the World Health Organization leading an international initiative for age-friendly cities. And while WHO says that it's for all ages, most of their material is focused on the aging population of older adults. But if you look at the list of what UNICEF considers to be critical features of a child-friendly city and what WHO considers to be critical features to pay attention to in an age-friendly city, there are many common elements. And so I think this creates an opportunity for us to come together and take a multi-generational planning approach. Now, what about gender? Planners have a problem with gender bias. You can see it particularly in transportation planning, and that's why I'm so glad that Jana is going to be the next speaker, because for a long time we have focused our transportation planning on commuting instead of mobility. And commuting is something that workers do, working age people do, and mobility is something that everybody needs, children, women, seniors. And if we began to think about mobility planning as opposed to commuting planning, it would really change the way we think about how we plan transportation infrastructure. In addition, planners have not given sufficient attention to the formal care supports that women need. Child care is something that planners have been giving attention to maybe just for the last 20 years. And in surveys that we've done with APA, most planners are ignorant of the fact that there's a child care problem in their communities. If we think child care doesn't get sufficient attention, elder care gets practically no attention from planners. And so there's a real crisis on its way to us if we as planners don't begin to think about how our communities are organizing themselves to provide adequate child care, elder care, and other social supports. And when those supports are not provided in the community, they fall especially heavy on women. Finally, planners give almost no attention to informal networks for care support, family, friend, and neighbor networks. And I want to go to the next slide and make this point, because if you think about 3 arenas for planning, one is the physical design arena, and the goal here is to foster individual independence. If you have inclusive design, children, elders will be able to get around better, and so will the rest of us. And then at the other end, you have formal services. So you promote formal services either through the market or through government, but what we don't pay much attention to as planners is what role we might play in supporting informal networks, networks of family, friends, and neighbors. And I think this might be particularly important in rural and suburban locations, for example, when you think about mobility. Most communities in America do not have public transit systems. Cities do, but rural areas and many suburbs do not. So what are we going to do to address the mobility needs of an aging population? Well, we can think about neighbor-to-neighbor car sharing, and a number of communities have started to work with ITN America on this issue. There's also been some work to take all the excitement and movement around social networks online and think about how you could ground these in place. And NeighborWorks is just one example. They create a website that is neighborhood-based, and you can use it to track how things are going with your neighbors. You can use it for borrowing a cup of flour. You can use it for finding out, you know, my kid hasn't come home yet. Oh, he's playing in the backyard with my son. Has anyone seen our neighbor come out to get her mail? Yes, I saw her yesterday. And what these things are funded by local advertising. So this is something the city can put in place without any cost to the city. There's also been increased use of time banks, time sharing among people, especially for when folks are released from the hospital and they need a little extra care when they come home. And one that I found particularly interesting was Social Mirror, which is used by autistic individuals to sort of use both the camera on your computer as well as say, hey, am I dressed appropriately for this interview I'm going for? And others can comment. So there's a lot of opportunity here to use social networking to help strengthen family, friend, and neighbor networks. So what's planners' role in this? First, we can share the information. We can give legitimacy, like the local government is supporting this. We can stimulate participation. So I want to give you a framework for thinking about this. WHO has the notion of a functionality curve, which sort of starts in adult life and goes to older age, and this is the orange line at the bottom, and talks about how our capacity as individuals to get around, to do things for ourselves, declines with age. But we backed it up and said, well, think about early life. Think about when you're born, and how you would learn to walk and learn to ride a bike and then learn to drive a car. And so your capacity is also increasing as you age. And with inclusive design, we can make it possible for greater capacity, greater independence for both those in early life and older age. But if you want to get to full capacity in an enabling environment, you're also needing to pay attention to service provision. So there's this trade-off between inclusive design and service provision. And in communities that aren't blessed with the best design in the world, you sort of need to make up for it with better services. And of course, in that service provision, we have both formal services provided by government or market, and we also have services provided by informal family, friend, and neighbor networks. So I want to turn my attention now to talking about some of the challenges, particularly as it relates to service delivery. So we know that we have a rising senior population, but you may not be aware that it's rising especially quickly in rural and suburban communities. The built environment often does not facilitate aging in place, and yet we know that most people want to age in place. And service delivery lags in rural, suburban, and poorer places. And yet these are where we're going to see actually higher percentages of older adults. In addition, we have the invisibility of demand. Older adults are going to create all sorts of new demands for services in the marketplace, but there's an invisibility of that demand both to government and to market providers. And planning has a role to play in both stimulating a market and a government response. So here, just quickly, I'm giving you some basic stats on the population over 65 years old, and you can see it's much larger percentage of the rural population, but the growth in that population is highest in suburbs. So whereas suburbs were designed for the nuclear family, they are now becoming home to a lot of lone seniors, and we really need to think about what the isolation and transportation and service delivery issues are going to be there. Children are relatively evenly distributed, but poverty is not. You'll see that the poverty rate for seniors and for children is much higher in rural areas than in either suburbs or metro core areas. Income is also lower in rural areas, and services for seniors are lower in rural areas. I'm going to use data from the 2010 Maturing of America survey, which was conducted by the International City-County Management Association for the National Association of Area Agencies on Aging. APA participated, so did National League of Cities and National Association of Counties and Partners for Livable Communities, and the survey was funded by MetLife Foundation. They measured 41 services for seniors in all sorts of areas: housing, health, transportation, nutrition, recreation, but also in workforce development, because increasingly seniors are still working. The average municipality provides 23 of these 41 services. The survey also measured 7 planning actions that communities might do for aging in place, and they measured whether the community actively promoted elder participation in the planning process and if they had any intergenerational programming that combined elders and children. And what you'll see in this chart, the orange bar is the Metro Core bar, and for every service, without exception, there's more service availability in Metro Core communities than in either suburbs or rural areas. But rural areas and suburbs actually are planning for an aging population. This is something that I think is a real bright spot in the survey. You'll notice that I'm looking here at 3 of the planning functions that were measured on the survey of the 7 that were measured. So zoning requirements for complete streets, building codes for universal design, and zoning that supports aging in place. Suburban communities were more likely to be doing something in this area than either Metro Core or rural communities. And that's good news, because there's a big challenge in both rural and suburban communities. So then we went on and did a statistical analysis to help us answer 2 questions. The first was, what determines the level of services provided by government and by market in a community? And the second was, what causes communities to do more planning for aging? And we controlled for intergenerational programming. We controlled for need, both population-based measures of how many elders are in your population or how big is your community, and also poverty-based measures. And we looked at the potential trade-off between the needs of children and elders. We controlled for built environment, what was your level of density, single-family homes. We also looked to see if you had mobile home parks, because again, for many cities and for many suburbs and rural areas, mobile homes give you a density of development that allows you to target services there, and they're also places where you'll find lots of elders and children. With regard, we also controlled for capacity, the income of a place, government expenditures, and state and federal aid, and metro status. And what did we find? We found that planning and participation increased service delivery levels by 3 to 6 services. So if you think of the average community offering 23 services, the communities that actively plan for elders and include elder participation in planning provide 3 to 6 more services on average than other communities. So planning matters. We also then looked at planning, like what defines who does more planning, and after we controlled for population and capacity and form of government, we found that rural areas and suburbs actually are doing more planning, which is good news, but that those municipalities with more single-family homes are doing less, and those are arguably the ones that need more. And counties that had more mobile home parks were also doing less. And again, this is an area where I think we could give some attention. Now, clearly these results show planning matters, and that should be good news to any planner's heart. We see that planning and elder participation stimulates not just a government response, but a market response. So, this back to this problem of invisible demand. Planning has as an ability to make invisible demand visible to both government and visible to private providers. And this is also good news at a time of fiscal stress, that planning can play a role in helping market actors, small businesses, recognize a new market out there and providing services for seniors. We also see potential for multi-generational planning because we measured this possibility of a trade-off between meeting the needs of elders and the needs of children, and we did not find support for that trade-off in the studies. This was not something that communities were showing a problem with. And capacity constraints, which we felt would be really strong in preventing rural and suburbs from participating, actually they're not as strong as we feared. But at the risk of alienating Christine, who's a leader of the New Urbanism Division, I'm going to throw a little provocative issue out here that new urbanism is not the only approach. It seems to be the sort of ideal approach for dealing with aging in place. But I'm going to argue that for many suburbs and rural areas, new urbanism is not really a very viable option. If you don't have development pressure, you're not going to get to redevelop your physical space. So you're going to have to sort of live with the design you've got. And so you're going to need to pay attention to new approaches to service delivery and new approaches to informal networks. Now, we held a series of facilitated discussions with the Small Town and Rural Division of APA at the April conference in Chicago. And the rural and small town planners there were coming up with brainstorming all sorts of ideas of things that we might be able to do. And I'll point you to my website because we actually wrote up a series of short newsletter articles about them. Bring back the milkman and home delivery. And this could actually be an opportunity for small business, for example. One of the issues for redesigning existing neighborhoods is to promote accessory flats, because what you need to do is you need to increase density, and you want to promote intergenerational neighborhoods because that allows for the kind of informal network sharing across generations that makes it possible for people to age in place. When we did the 2008 survey with APA on planners' role in creating family-friendly cities, we asked if their communities allowed accessory flats. Only 25% said yes, so we clearly have a lot of work to do there. I also want to mention in closing the possibility of joint use with schools. On that same survey in 2008 of about 960 planners, only 43% of them said that they work with the schools and communities they work in co-locate services in schools. Less than half even work with schools on site planning. Schools sort of operate in a silo and they don't play well with others. But we as planners need to reach out to schools. They're a source of information and they're a source of facilities that could be better utilized in the community. In the picture on your left, you'll see Charlotte, North Carolina, where when they built a new elementary school, you can see it's there's a creek bed with trees on the left-hand side, and they didn't have enough flat ground for a playground. Well, the city was also putting in a light rail station, and it needed a park and ride lot. So what they did is they made the top of the park and ride lot a playground, and they were able to join capital funding from transportation and from the school to make this happen. On the right-hand side, you see a senior, a very happy senior, getting on a school bus. Now, she's in New York City. New York City, with one of the best public transit systems in the country, is using its school buses when they're not busy taking kids to and from school to take seniors to the grocery store. Now, I said earlier that the majority of communities in America don't have public transit systems. That's true. But it's also true that every community in America has a public transit system called the school bus. And for seniors who are still mobile, meaning they can get up the stairs, they can ride these school buses, and it could create an opportunity for helping people to get around. Think about it. Finally, let's think about obesity and activity and the fact that parks are inequitably distributed in our communities. And yet we have school playgrounds that are more evenly distributed, but many have signs like the one in this top picture that says, "This is not a public playground, stay out." Well, Tucson, Arizona decided that one way it could address its parks problem is by working with the schools to open up the playgrounds in the afternoon for everyone in the community. And this involved shared service agreements between the police, the parks department, and the school to work together. Yes, there's challenges and barriers in terms of liability insurance, which is easy to cover, scheduling and staffing, which requires communication, maintenance issues, but there's also plenty of benefits that you're better utilizing your school buildings and playgrounds, particularly if you're in the Northeast where we're actually losing young population and our schools are overbuilt, but we've got an aging population that needs a place to be. You can promote active aging, and it's also a way to promote intergenerational interaction, adults reading to children and building cooperation with community government and schools. Communities that share facilities with their schools also find that they're more likely to get positive votes when it comes around to school budget. So in conclusion, I think multi-generational planning provides a strategy for the future. You can see how we can broaden the aperture in the way we think about inclusive design. We can break down some silos when we think about shared services, and hopefully that can take us toward a common vision. I want to point you to some issue briefs that are on my website, which is www.mildredwarner.org/planning. My students here at Cornell helped me develop a series of issue briefs on joint use with schools, health impacts, rural differences, gender concerns, informal networks, and as I mentioned, all these newsletter articles that came out of the Small Town and Rural Division discussion group. So I encourage you to go there and use those materials, and I look forward to the Q&A coming up. Now I'm going to turn it over to Jana.
Good afternoon. Thank you very much, Mildred, for that excellent framing presentation. I'm going to do a bit more of a data dive initially and then try to broaden out and provide some examples of programs that I think are particularly successful in helping individuals age in their communities and touch upon, building off of Mildred's theme, some of the intergenerational work that we can encourage. So first off, some of you may have noticed.
I'm sorry, Jana, I have to interrupt. We can't see your screen. Did you hit OK for us to see your screen?
I'm not. I thought I did, but I don't show my screen. Okay.
Thank you.
Can you see it now?
We can see it now.
Excellent.
Thank you.
And one of my colleagues has not muted themselves, so please do that so I don't get feedback. So this is a publication, National Geographic, that came out in May of 2013 that some of you may have noticed. And the cover page is, "This baby will live to be 120." And the subtype of this says, "It's not just hype. New science could lead to very long lives." Getting to grow older is the great gift of the 20th and 21st centuries. In 1900, life expectancy was only 42 years. Through a series of public health advancements, social policies, and programs, life expectancy is now 78 for a man and 81 for a woman. In 1940, only 7% of the population survived age 90. 10 years ago, 28% of Americans age 65 could expect to survive 90, and in 2050, it's projected that 42% of us will survive 90. This is a dramatic longevity change that has occurred over a relatively short period of time. We're really the first generation of planners to confront such profound demographic change, and it really requires that we all rethink our planning toolbox. Today, about 13% of persons 65 and older are persons 65 and older in the United States. By 2030, we are expecting to see that increase to 20% of our total population. Now, Mildred touched upon some of the gender issues that we should all be cognizant about. Just a little bit more of a data dump for you all in case you want this reference. Women, again, they're more likely to live alone. They tend to live longer. They're more likely to live in poverty, and they earn less over their lifetime. About 76% of full-time working women 55, they earn only about 76% of men's earnings. And as a result, they've received lower Social Security benefits, about 20% of men's. And as Mildred pointed out, they never really get to retire. There is the cost of caregiving. It's a tremendous contribution that women and the men that do caregiving provide to our society. About 2/3 of caregivers are women, and it's estimated that the unpaid work of family caregivers is valued at $450 billion a year. Caregiving may substantially increase a woman's risk of living in poverty and in old age, because we're finding the stories that women tell that they are reducing their hours of work, in some cases not having to give up jobs entirely, choosing to work part-time, taking jobs that may not be as meaningful, as well-paying as they would otherwise if they didn't have these additional responsibilities. The individual cost of women leaving the workforce is estimated at over $300,000 in lost wages, Social Security, pension, and retirement savings. And in total, women have 12 years fewer in the paid workforce over their lifetime. Now, much of my research in the past several years has focused on analysis of the National Household Travel Survey, and I think there's some really interesting differences in travel between men and women that I just wanted to highlight rather quickly this afternoon or this morning for folks way out there on the West Coast. We're finding that in terms of vehicle miles of travel, older men's has decreased between 2001 and 2009. Older women's increased, but men 65 and older still drive about 2 times the number of miles as older women. Now, similarly, older men's licensing rates have been on the decline while older women's have been increasing, but older men's licensing rates are still higher than older women. But because of the greater numbers of older women out there, we see there's actually more older female drivers than there are male drivers. This is just the licensing rates chart. You can see that for men, it's nearly universal licensing rates, certainly for Gen X and boomers. Among women, it's near universal licensing, somewhat lower for persons over 65. Now, this is just a fun slide that I like to pull on discussions of gender that was pulled together by my colleague Nancy McGuckin using the National Household Travel Survey data. And she found that traditionally when a married couple travel together, the man is more likely to drive. Women drove only 22% of those trips. And you might say, well, you know, maybe that's including all of the older women in more traditional gender roles. But she looked at this across the lifespan among women of all ages and found that regardless of age, women were more likely to slide over into the passenger seat and let the male drive when they were in a car with them. And this actually has some implications down the road, I think, in terms of women having the confidence behind the wheel. And other researchers have pointed out that women sometimes give up driving before they really need to do so, limiting their mobility, and the reverse, that older men may not give up driving quite soon enough. Now, moving more to the crux of our discussion on the implications for planning, with increasing longevity, many seniors will age past driving age. And you can see that overall, on the national average, among persons 65 and older, about 21% of older adults do not drive. But if you look at the oldest age groups, 95 and older, you can see many more older men and older women have given up driving. And if you think back to my first slide, there are tremendous implications for how many older non-drivers we are going to see in the very near future that are going to need transportation in our communities. Currently, we tend to outlive our driving years anywhere from 7 to 10 years, meaning there's 7 to 10 years at the end of our lifespan when we don't drive. If we increase our longevity another 10 to 15 years, we could potentially be looking at 25 years of being a non-driver, and you multiply that by the millions of boomers that are now aging into retirement age, and it's very, very significant with profound implications. Today, 8 million older adults, 65 and older, do not drive, and older women outnumber older men 3 to 1 as non-drivers. Most of these older non-drivers live in the suburbs, and a really seminal report by T for America entitled Aging in Place, Stuck Without Options found that by 2015, more than 15.5 million Americans 65 and older will live in communities where public transportation is poor or non-existent. It's mentioned before that women are much more likely to live alone, as you can see in this slide, and that also has implications on their mobility as they age. So what are some potential planning solutions? First, we need to invest in and coordinate specialized human services transportation. We should be supporting volunteer driver programs, looking at our design infrastructure, the design of our infrastructure through improvements such as complete streets to aid not only pedestrians and bicyclists of younger ages, but pedestrians of all ages as well as drivers, including older drivers. Integrate land use and transportation planning through mixed-use development like transit-oriented development, and invest in public transportation service and education. And these are just several of the many ways that we could discuss to improve the mobility of older adults. So first off, mobility management. This is a concept, a term that's fairly familiar to folks who are working in the specialized transportation sector, but probably less familiar to planners. But it essentially gets at the heart of what Mildred was pointing out, that we need to move from the idea or the focus on reducing congestion, providing commute trips, etc., to more of a focus on accessibility and mobility for everyone. And there's actually a growing profession out there of mobility managers that help communities implement this concept. And it's carried out in a number of different ways depending on the community. And it's something that's actually encouraged through the MAP 21 legislation as part of the guidance under the 5310 specialized transportation program that FTA manages. So, for instance, a mobility manager may work in the community to help that community to develop what's called a coordinated human services public transportation plan. It's required by FTA to receive Section 5310 funding, but it's really an opportunity in the community to bring all the stakeholders together to understand what are the service needs for older adults, persons with disabilities, and low-income individuals. A mobility manager may also be reaching out and developing additional local partnerships, connecting hospitals and clinics to public transportation providers to say, what are your health transportation needs to healthcare, and how can we help meet those within the community, and as well as addressing other institutional types of issues. A mobility manager may function as more of an operational service broker, providing direct transportation, connecting customers and transportation to transportation and funding agencies, conducting travel training to teach people how to use the public transportation system, helping them map out individualized trip plans. They're functioning somewhat like caseworkers. So mobility management can really take many forms. It also can take the form of technology, getting the technology on the fleet of buses and other vehicles in the community so that coordinated trips can occur, that transportation being provided by one agency is coordinated through a central dispatch center, so someone can call in and say, I need a ride, and whichever bus, regardless of entity that's providing the service, can go in and pick that individual up and give them a ride, and it has a system in place to deliver all the accounting necessary to accomplish that. So Marin Access is part of the Marin County Transit Agency, and they have a Marin Access Mobility Management Center. It's one of the best examples that I've found on mobility management. They are providing a one-call, one-click mobility management center that customers can use to schedule rides on any of their services. They offer, of course, as the transit agency, fixed route transit, which doesn't require scheduling a ride, but they also are under contract to provide ADA, paratransit services. They have a volunteer driver program, a taxi discount program, and their mobility managers work directly with clients to teach them how to use these various services. One thing I want to point out with this program is how it's funded. Just a couple of years ago in 2010, voters in Marin County approved a referendum to increase their vehicle sales tax by $10 annually, with all of the money being dedicated to transportation and 35% of that being dedicated to the Marin Access Mobility Management Center. So it's one of the few examples in the country where, with these increasing number of local sales tax or other types of referendum, that the community is thinking broadly and thinking about the needs of the entire population, not just commuters, but persons with disabilities and older adults as well. A second example that I'd like to highlight of transit providers that are doing a wonderful job serving the needs of the entire community is River Cities Public Transit. They are based in Pierre, South Dakota. They provide general public transportation, demand response, which is essentially dial-a-ride type of service. So you can use their service regardless of age. However, because of their demographics and the need, about 60% of their riders are age 65 and older. But to point out the intergenerationalness of this program, they work with the schools and the parents and parents can basically purchase vouchers to provide their kids with transportation between school and school activities. Mildred had said that every community in the United States has school bus service. Well, actually that's not really the case. Many do, but Pierre, South Dakota does not have any form of school bus transportation except perhaps for children with disabilities. And so parents really need to look to this nonprofit provider for assistance in getting their children around when they're not able to do so because of employment or other reasons. Well, but some of the exciting stuff happening out of River Cities Public Transit is about 10 years ago, they hired a new general manager, and he has been able to increase their ridership from about 12,000 rides in 2001 to over 300,000 rides in 2011. And he's done this by reaching out to all of the surrounding counties and offering this service to their residents under contract. And they've just been growing their service area, growing the number of people they serve, and really providing this coordinated service across a very large region. In addition, they are working with hospitals and clinics in Sioux Falls and Rapid City on the opposing ends of the state and providing medical transportation with subsidized or lowered fares for certain days of the week, and working with the hospitals and clinics for them to be promoting the scheduling of individuals coming from different parts of the state on the same days so they can really maximize efficiencies. A third example I like to highlight is Washington State's inner-city bus network. And Washington State has done just a phenomenal job of promoting a public-private partnership with Greyhound and other private sector inner-city bus providers. And they're actually able to get a subsidy from Greyhound that is kind of an in-kind subsidy that FTA counts as the local matching contribution to receive federal transit dollars. But in Washington State, you can go from Port Townsend, population 9,000, to the Seattle medical complexes, to SeaTac International Airport, to the Greyhound bus station, Amtrak station, connect to this entire system shown here on the slide. And it's actually a system that I was so impressed by when I learned of it. I went out this summer with a cameraman from AARP, and we did a week of filming, and we'll have a video out on this system hopefully this fall. But finally, let me talk about public transportation services. Very essential for many older adults, but often difficult to access because of the design. And there's very simple ways that we can improve the accessibility of our public transportation system through the purchase of low-floor buses that really eliminate the stairs that older adults have to climb up in order to get on the bus. This could potentially, for many, be a problem with using the existing fleet of school buses out there. If you have cranky knees, it may be difficult to get on and off. Placement of grab bars, preferred seating, large print on schedules, not only on the print schedules but also at the bus stops, providing plenty of lighting at those bus stops so that people feel secure as well as are able to read the schedule at night. Benches at stops, courteous drivers, something in survey after survey older adults tell us, you know, drivers just not really that polite. I don't feel comfortable taking the bus. So always something to work on, and making stop announcements so that people know where to get off, particularly those who may have visual limitations. We've mentioned the need for support for volunteer driver programs, other types of supplemental transportation programs, and that's extremely important. As much as public transportation does fill a role in providing services for older adults, today in the U.S. 2/3 of trips taken by non-drivers 65 and older as passengers in private vehicles. And many are most comfortable with this type of service, but that puts a lot of pressure on family caregivers to provide transportation to their loved ones. And this is definitely an area for fairly low cost. A community can come in and offer some alternatives and provide those services. Back to design, I mentioned complete streets. I think planners are pretty familiar with this concept, but in case not, a complete street is one that's safe, comfortable, convenient for travel by automobile, foot, bicycle, and transit, regardless of age and ability. And one of the design elements that we promote, which is actually contrary to what many of our members tell us they like in survey work, are roundabouts as a complete streets network. It really improves the safety at intersections. Older drivers are overrepresented in left turn crashes where they misjudge the speed of oncoming traffic, and roundabouts completely eliminate the left turn. And there's been plenty of literature out there promoting the other benefits of roundabouts as well. So that's just one design element that I like to mention in complete streets presentations. I mentioned transit-oriented development, and for folks who want to understand how you might think of transit-oriented development as beneficial to older adults, I invite you to visit my first video on our website, which is a 6.5-minute video that was filmed in Arlington County, Virginia, along the Roslyn-Ballston corridor of the Orange Line in their TOD neighborhoods. And we interviewed older adults living in those neighborhoods to understand how they got around. We interviewed some elected officials as well. So it's quite fun and invite you to view it. Now, I've talked a lot about transportation because that really is the focus of what I do here at AARP, but I think it is important to also mention universal design and how we make the home environment more accessible for aging. And this is just pointing out a few of the features to consider in any zoning ordinance that would try to address accessible design. No step entrance, wide doors, at least 32 inches for a net opening so that persons with wheelchairs, scooters can maneuver through those doorways. Flexible room layout and design. Maneuverability, again, so people can get turned around if they're in a seated assistive device. Low threshold shower. If it's difficult to walk upstairs, it could be difficult to get into the bathtub as well. Grab bars, rollover sink, lever handles, etc. And oftentimes when homes are being built, some of the foundational structural elements can be put behind the walls in order to, like structure for grab bars, to make it less expensive to go back in and retrofit a home when the time comes that residents of that home need some additional supports. Easy to reach and operate appliances. Reinforced bathroom walls, which again helps to provide for grab bars later on. And electrical outlets that are kind of at a middle height, so you can easily reach them if you're in a seated wheelchair or scooter. Easy to reach cabinets, etc. So one of the pieces of legislation that we promote, we have model legislation through AARP that's called Inclusive Home Design, which gets at these various universal design elements, but we also promote visitability, which is similar to universal design, but it really focuses in on the 3 key features that are absolutely essential for accessibility: a zero-step entrance, wide doorways, and a bathroom on the ground floor. So these are the features that if you have a temporary disability or you have someone who has a disability who wants to visit you, you're able to welcome them into your home, or you're not forced to leave and go into a nursing home to recover from, again, a temporary disability. So that concludes my presentation. This is our contact information, and I guess at this point we'll be happy to answer questions. Hello?
Hello, I'm here. Sorry, my phone wasn't working properly. Okay. Thank you very much. This was really great. Now, let's go ahead and run into some questions and answers. Does anyone have any? We don't have any up right now, so go ahead and put those in your chat box, and we can go ahead and get those going.
While questions are coming in, could I just offer one additional piece of information? AARP has recently launched a age-friendly communities program here in the United States. We're an affiliate of the World Health Organization's age-friendly communities program. We do emphasize that we're trying to plan communities for all ages, and this is something that may be available to your community if you are interested, and I'd be happy to put folks in touch with some resources about that.
Well, it looks like everyone's having a Friday afternoon. It doesn't look like we have any questions right now. I guess I would say that if anyone does have any questions, that they can go ahead and contact everyone. Oh, we have one here from Maureen. Do you have any examples of comprehensive plans that incorporate good policies on aging?
Yes, I think there are some out there. I would say one of the best that I'm aware of is the Lifelong Communities program of the Atlanta Regional Commission. The Atlanta Regional Commission is the MPO that houses both the planning and transportation departments as well as the Area Agency on Aging, and they've done a lot of excellent collaborative work to develop new policy that addresses the needs of older adults. So I'm not sure it's exactly in the comprehensive plan format since it's a regional entity, but much good policy language that you can pull from. In addition, I have a publication called Aging in Place, a state survey of livability policies and practices, and we have a couple of examples in there. Forgetting the names off the top of my head, but it was a state plan with policy guidance for the state of Georgia was one. There's also other programs, lifelong communities type of programs that are featured in that document.
This is Mildred. You can also look at N4A, the National Area Agencies on Aging Association. They also have a Livable Communities Initiative, and they profile communities that have been leaders in addressing aging in place issues. So another resource is the Age-Friendly New York City. Even though they're New York City, which is kind of a unique city in the U.S., they are often called upon to help think through planning for aging for other communities as well. And that's based in the New York Academy of Medicine. And I believe that APA is organizing a special session to look at these issues in about another month or so in Arlington, Virginia, and at the next conference they'll be possibly moving toward a policy guide on aging in place. So I think there's going to be a lot more material coming available in the next few months to a year.
Yeah, and let me just add to what we've provided before. Mildred mentioned New York. There's also Portland, and that has done some great work in planning for aging through their Age-Friendly Communities program. And then AARP has a digital hub where we've been collecting information from communities on various community plans. And you are likely going to be able to find some decent planning examples through that. That address is aarp.org/livable. So the website I have up here gets you to our Public Policy Institute resources, and there are many, I think, very valuable research publications on housing, transportation, land use. But in addition, where that aarp.org/livable website is a repository where local communities can upload what they've been doing as well.
Going along with those internet resources, do they include things like model zoning regulations or complete streets implemented in rural communities? And I think someone else has a question about model sign ordinances that accommodate the elderly. Can we find all that kind of information on these sites?
Well, certainly on AARP/livable, you can find AARP's model inclusive housing design ordinance, and it comes in a couple of different formats depending on whether you want it to be a mandatory or a voluntary type of requirement. And then we also have a model complete streets ordinance that we've developed with the National Complete Streets Coalition. And in terms of model, what was the last one? It had something to do with road design.
Sign ordinances,
Christine, what was the
Complete,
last point there?
complete
Sign
streets
ordinances.
and sign ordinances, correct.
So a couple comments on the sign ordinance piece. The Federal Highway Administration has a publication that is called Highway Design Handbook for Older Drivers and Pedestrians. And in that, it includes some of the best sign design types like font size, retroreflectivity, ratios, etc. So it's intended for engineers, but it does get at that signage. Something I've been working on, well, not extensively, but it's come up in the local planning work that I do. I serve on my local transportation commission, and the pedestrian signage, sign ordinance, we had something come before us with sandwich signs to advertise restaurants, and there needs to be very strong language in the sidewalk for the sidewalk realm that provides ample pedestrian access zone that does not include any street furniture or signs that would encumber the pathway of the pedestrian. And this is particularly important for persons with visual limitations, but also can be important for older adults, etc. So, and there's the Access Board also has good sidewalk design parameters as part of their PROAG guidance. And one other point with sign design is to think in terms of someone who does not see, and as they're going along, could they walk straight into something hanging overhead versus the sandwich type of design, and making sure the ordinance is written in a way that very clearly prevents that type of signage.
Great. We have a few issues linked to security. One of them is, can you speak to the security issues for older adults in all areas? And then similar to that, are you aware of any examples of linking older adults with younger children through the Safe Routes to School program?
Mildred, I've answered two questions. Do you want to take a crack at any of those?
Sure. One of the sets of questions that was addressed in the Maturing of America survey was services related to security and elder fraud and police being sensitized to the unique security needs that older adults may face. And this is an area of growing concern and one that communities should give more attention to. And if you go to my website, and also if you go to the N4A website, you'll find the summary of the results of that survey, differentiating by metro, suburb, and urban core areas. In terms of linking adults and children, some really exciting work is being done by a group called Generations United, which is based in DC, and they're actually very U.S. focused but also have international involvement. And they're interested in intergenerational interaction, co-location of services, and involving seniors and children together in advocating for each other's needs. And they had a very dynamic conference in DC this summer, and on their website they have profiled lots of community initiatives around the country and around the world where people are bringing together the two ends of the life cycle in ways that are very, very productive and very exciting. So I would recommend to you Generations United, and also on the security issue, this is an issue that's hot, that's up and coming, and you can see sort of the state of play at the Maturing of America survey.
And specific to the question on safe routes to school and whether anyone has linked perhaps older ambassadors to lead walking school buses. I attended the Alabama APA chapters conference this year, and there was a speaker there that I met who is doing just that. They have a program where they're connecting older adults in the community to help chaperone the kids in these walking school buses. I'm not sure if the state was Alabama that was doing it or a neighboring southern state, North Carolina, South Carolina, and I apologize. But I would bet if you contacted the National Safe Routes to School National Partnership that they may have more information on resources, places that are doing some innovative things like this. I think it's a wonderful idea.
Great.
When we did the
go ahead.
APA survey on family-friendly communities, safe routes to schools was one of the most common things that communities reported doing, partly because there's money to do it. But it has a lot of potential, and there's a lot of examples also with that survey, which is also available on the APA website, and that's summarized in a Planning Advisory Service memo on planners' role in creating family-friendly cities.
Great. Is there any thought, and this is a good question, is there any thought to the traditionally utilized 65 age being modified as healthcare improves and citizens are in the workforce longer? In other words, is 65 really still reflective of an age representative of a lifestyle change?
That's a really excellent question, and I think certainly we could cut the data by 75 and older. The data seems to, sample sizes of various data sets seem to be large enough to do the 60 or 65 cut a little easier than the 75 cut, but certainly with longevity, the 75 is the new 55 in many people's minds as well as in their lifestyles, and it is certainly true that people are postponing retirement, working longer, etc. And in fact, I have a paper, if anyone's interested, on work. It's entitled Work-Related Travel in an Era of Extended Employment, that folks may be interested just looking at some of those travel trends of older employees commuting.
This is Mildred. One of the things we did an issue brief back in 2011 on the economic importance of families with young children, and we looked at national data on public expenditures by age. And for state and local governments, the big increase in public expenditure starts to occur around age 75 and then really explodes going forward. So there's definitely a reason to think about the over 75 and particularly the over 85 members of your population as being those who are likely to need more services and therefore have a bigger impact on the local government budget. And the kinds of services that you would need would be different. I know in New York City they're working very hard to help particularly women who may not have the 40 quarters of employment that they need to get Social Security, to help with job training and job placement so that they can get enough quarters of formal sector employment that they can be eligible for Social Security. And so thinking about the different needs for different ages, we can't just talk about older adults as one category. There's a lot of diversity in that category, and thinking about the different ages and the needs at different ages is one way to begin to think about that.
Yeah, excellent points, Mildred.
All right. How does planning for tourism-based communities deal with senior visitors, particularly as it relates to scenic byways?
Interesting question. It reminds me of my work this summer in Washington State when we were filming for the rural inner city bus video, and one of the communities I mentioned was Port Townsend, which is very much a tourist destination in the summer. It's also a retirement community and a regular community, and I don't know that they've necessarily done anything in the work of scenic byways, but they have done quite a lot of work to ensure that they have a robust public transportation service offering. For a town of 9,000, they have bus transportation every 30 minutes to an hour, 6 days a week. It was 7, but recession has pulled that back some. And they've done a good job connecting it to the ferry terminal. As people get off the ferry, they can walk a block and get on the bus and go to other destinations in town. And then it's also served by the inner city bus network. Just some thoughts of my own on scenic byways. Of course, there's always that balancing tension between sort of preserving the rural character and having the design available that is safe and accommodating. And I would say that there's simple measures that one can impose that is not that would not necessarily take away from the scenic character. The first thing I think of is the placement of chevrons in the placement as recommended by the Federal Highway Design Handbook for older drivers and pedestrians that help people get around those corners and notice the turn well in advance of having to make a turn during nighttime driving, as well as improved retroreflectivity and larger font signs, etc. And also, I know this can be controversial in particularly rural communities that want to retain their rural character, but even adding a 2-foot shoulder can be very much a safety enhancement on a rural highway. And it also, as the state of Iowa has found, having those 2-foot shoulders actually reduces maintenance costs because the deterioration of is happening on the shoulder as opposed to the road over time.
Somewhat related, regarding...
Small town and rural...
oh, go ahead.
Go ahead. I'll wait.
No, it's fine. Please.
Well, I was going to say, at the small town and rural discussion group that we had at APA, some of the rural members who were from scenic and retirement destination communities talked about the challenge of getting their, not tourists, but seniors that move to their community to retire to be realistic about housing options when they move in, if they're really thinking about aging in place. And what they're seeing is both the development of housing that doesn't meet universal design standards and the location of housing that really is not going to enable these older adults to age in place successfully because they're going to be isolated from services. So it's a real challenge, particularly in retirement destination communities, of sort of getting the kind of consumer education that we need to occur so that people are more realistic in planning ahead when they think about moving to a retirement location, actually moving to one where they can age in place. And this was a frustration to a number of the rural and small town planners that were in retirement destination communities. Might be something that could be a role for thinking about the kind of zoning that these communities, or building codes these communities put in place. And I know AARP has been doing a concerted effort of consumer education around housing options as you age. You know, when we have children and form families, we think very carefully about the housing options that we pursue. As we age, we tend to be in denial and not necessarily choose housing options that make the most sense as we're going to age.
So true.
Related to that, with the destination or you know, retirement communities, regarding FEMA's announcement of New Jersey and New York homes along the Atlantic coast needing to be 13 to 15 feet above sea level, how could beachfront homes be accessible or visitable given the vertical siting codes to maintain insurability?
Huge issue. Mildred, do you have an answer for that? I would say elevators, but that's very expensive.
Yeah, so I do have a really weird, creative answer for it, which isn't really probably legitimate in any kind of building code, but the same issue came up after Katrina, and I was at a conference once where a building guy was talking about how locals are addressing this problem, and they're using their boat slips and elevators as essentially a poor man's elevator to get up to the second floor, because all housings in that particular area was supposed to be, the first floor was supposed to be on poles and everything was on the second floor. So they were using their boat hoist. Elevators are expensive.
They are.
And so this is a real problem, and actually this was a community where a lot of people were fishers, and so they were using their boat hoist. But I really don't know what we're going to do with this one. And it was actually a problem too, because they had even set these standards for the downtown stores needed to be up. So how do you get things up and get people up? This is going to be an issue.
Great. Switching gears, is there a common number of square feet for senior housing? Most homes being built now in the suburbs are 2,000 plus square feet, and some communities put a minimum square foot for single-family homes and townhomes in their zoning codes, therefore promoting large homes. Thoughts?
Mildred, do you have something?
No, I don't, but my sense is we need to start thinking about a population of more lone singles, whether they be lone seniors or lone juniors, and think about the housing codes accordingly. The other thing that I think's got a lot of potential here is how are we going to retrofit suburbia? And in the planning and gender piece that one of my students put together, she talks about the possibilities for co-housing, or some people are calling them Golden Girls homes, where you might have 4 senior women living together in a house. And so they're providing informal supports to each other, but you have to make sure your zoning code doesn't consider more than 3 unrelated women living in a house as a brothel. Evidently in some southern states this is still the case. We're here to talk about gender. We can talk a little bit about gender bias and the way things are done, but we need to rethink. Planning codes need to get in front of this issue and not be one of the barriers that's preventing us from moving forward.
Yeah, and I would just add to that that we do absolutely need to be looking not at minimum sizes for townhouses, homes in general, but be open to sort of cottage development that is much smaller in scale, tighter knit, closer together in the community. There's an example in our Aging in Place paper that I think it features Petaluma homes, where it shows a photograph of sort of cottage style housing, and a lot of places don't allow the density that would allow this to happen. And in fact, you can sort of limit the number of units, but just pull them closer together and make them smaller sized and make sure they're designed with minimum accessibility, and it completely changes who can be accommodated in that type of housing. And it's a design that tends to be able to fit in very easily into the character and scale of a small town, etc.
David Birchler, I'm sorry if I mispronounced your name, he just says, I believe minimum house sizes that are beyond the minimum livability size of the building code has been determined unconstitutional. Let's see, what else do we have here? Has there been any collaboration by planning organizations with medical research facilities working on age-related eye diseases as it relates to community planning and design?
Well, apart from the older driver handbook that does talk about age-related eye diseases, there's other information out there, but it comes back to the full range of accessible design that we need to be planning for times when folks no longer drive and need other types of services. But again, it comes back to my slide on design for public transportation services. One of my big peeves in my own community is, and I'm not particularly old at this point, I come up to a bus stop at a major transfer center in Northern Virginia at night, and there is no light above the bus stop sign, and the font is about a 7. And even with my cell phone light, I cannot read that schedule for the life of me. And it's these kind of design details that we just need to do a better job on all around.
If I could broaden the question to collaboration with hospitals and healthcare, there's really a huge opportunity here opening to us. I mentioned to you some of these time banks are actually networks of care support between the hospital and the community to help people with their return to home. Also, under the Affordable Care Act, hospitals, nonprofit hospitals, are required to provide community benefits beyond medical services, and these can include things like economic development, workforce development, and environmental improvements. And we profile in our issue brief on our website some of the examples of things that communities are doing. So if you haven't thought of your healthcare establishment as a potential partner for planning efforts for aging in place, now is a good time to do so.
Yeah, another piece of the Affordable Care Act is that larger hospitals are now being penalized for readmission rates, high readmission rates, and there's a direct connection there to transportation service in the community. If someone can't get back to the doctors for their preventive maintenance and follow-up visits, they're much more likely to end up back in the hospital. And for fairly minimal community investment, those types of medical issues could be avoided.
Okay, so we have a question here from Jenny. So does gender matter? Sounds like there is greater need for women, but is there anything specific regarding planning for older women versus the general aging population?
Well, I think what we need to do is think about the stereotypes and the blinders that got put on us because of our training. So those who were trained as planners, say 20 years ago, you probably didn't talk about mobility management then. You talked about commuting and congestion. So if you let that be the paradigm shifter that makes you think differently about transportation now as mobility, what would be the similar kind of paradigm shifter for economic development planning? Well, one thing would be helping to make sure every woman in your community gets her 40 quarters so she could get Social Security. It would be thinking about workforce training for older adults, not just for young people. If you're thinking about economic development strategy, it might include giving loans and business management support to child care and elder care centers or to new emerging businesses that are serving the aging demographic. Local services are ignored by economic developers. We're always looking for the next firm to recruit from outside. Exports drive the train, when the reality is that 80% of all employment in America is now service-based, and the majority of that is serving local people. But there was a bias that we were all trained with, which is actually a gender bias in economic development policy, which says that local serving jobs and household serving jobs don't count. So what we need to do is we need to go back and query our training and think about the reality of the lives we live and how would that change the way we think about housing, economic development, transportation, street design, etc. Even things like when you hold and where you hold and how you hold community meetings. We know that participation rates of families with young children are lower because most communities don't provide child care and they hold meetings at dinner time. We might begin to think about all sorts of different modalities, time, place, technique that we use to reach people, recognizing that a larger and larger percentage of our population is not only older, but it's women and older. And it's time to think about the differing ways in which women use space and engage in the economy and accommodate our planning to them and not the other way around.
Great. This is going to be our last question. Do financing programs to support affordable senior housing support and promote these ideas?
Well, I am not a housing expert. I believe they can, depending on how those programs are designed, certainly support affordable senior housing programs at the federal level. I guess there was Section 202. I don't think it's been funded in a maybe community choice program now that builds affordable senior housing. But again, it's thinking through how to structure a housing finance program that will meet the needs of people as they age. It would be providing if it's sort of a competitive bid process to find who's going to build this with public sector support, giving extra points in that evaluation process to those who are offering to put in accessible units and other design features that make it easier for people to move about within their homes, as well as interface between their home and the larger community through improved design. Location decisions of that housing as well. Don't locate it on the hinterlands, try to bring it into the downtown area or areas where there's a higher prevalence of services that people can access by various means of transportation.
With regard to shared services in general, one of the problems that we have, which is a legacy of our age-segregated service delivery system, is that we have rules either from the federal government or the state government that require minimum space needs for children in child care centers that are different for elders, and so it's hard to have elder and child care co-located. What we need to do as we identify these issues is to work to change them. You know, we shouldn't let rules that were put in place in an earlier time period be the thing that stop us. We have to work on changing them. There are lots and lots of regulatory barriers, particularly designed around securing the safety and security of children and frail elders, that in fact do make it difficult to do intergenerational programming and co-location. But I think that's going to change, particularly as more and more planners start pushing for it.
Great, thank you. Do either of you have any final comments before I wrap up today's session?
No, I guess not. I would just encourage planners to, keep in mind that we're trying to meet the needs of all ages in our community, and really thank you for participating in this call. Hope it was useful and you got some interesting information that you can put to use in the local planning work that you do.
Great, thank you. Just a few reminders for those that are still hanging on. You can log your CM credits for attending today's webcast by visiting planning.org/CM, selecting today's date and the presentation title. The webcast will be available for 1.5 credits. And again, we are recording the webcast and it will be available on our YouTube channel. Just log on to youtube.com and search Planning Webcast. And if you would like a copy of the PDF of the presentation, you can email me at planningwebcast@yahoo.com. Thanks again to everybody, Jana and Mildred, for joining us this afternoon. Elizabeth, the Professional Development Officer with the Virginia chapter, if you're still hanging on, thank you for helping to coordinate this. And this concludes today's session. Thanks everyone for attending, and have a great weekend. Bye-bye, everybody.